Hey guys, welcome to 101nursing.com. My name is Priscilla, and today we'll be talking about Parkinson's disease. Parkinson's disease is a degenerative disorder that usually comments the older crowd. A lot of the reasons why people obtain Parkinson's disease is related to age, hereditary, if you obtain it from your parent directly, grandparent. Males are more likely to get it than females. That's not to say females don't get Parkinson's disease. And people that were exposed to toxins such as pesticides and herbicides are slightly increased risk for Parkinson's. Trauma, per usual, and long time pheno, pheno, or antiemetics, long-term uses of antiemetics. Brief patho for this disorder, it's a lack of chemical receptors called dopamine within the brain. And this is a chronic nerve disorder. And that dopamine helps get messages across to the brains, to receptors within the brain. And it also, the ability for the brain to produce dopamine dies or becomes impaired due to any of those risk factors. And one of the things that is really interesting about people with Parkinson's disease is this Lewy bodies. Lewy bodies are proteins found specifically in people with Parkinson's, their brain, and this protein is still being tested and still being used or being figured out by scientists today. How do you diagnose this disorder? Primarily, the diagnosis will be your family history, then neurological exams, and other medications can mimic Parkinson's disease. So sometimes you can see a patient with Parkinson's disease, however, the person is on Reglan or Compensine or other different medication that can mimic Parkinson's disease. But definitely want to check out that family history, medical history. That's very important. And the cardinal sign of Parkinson's disease is tremors. Slow moving people and tremors. As you guys can see in this picture, you've got these little just waves just to mimic tremors, and then that slow moving shuffle gait here, and you'll definitely see that with Parkinson's disease. And you want to promote rest and to the patients to slow down. I actually had a boss with Parkinson's disease, and she was really she ran the hospital. She actually ran the library, the entire library, and the job worked for her. And I believe she was in her 60s. But stage 1 for Parkinson's disease is very mild. It's the initial stage. It's unilateral limb involvement. There's little to no weakness, and hands and arms tremble a little bit, but they're not really noticeable. Stage 2 is a mild stage, and you'll see bilateral limb involvement. You're going to start to see that mask-like face and slow shuffle gait. And that boss of mine really did have a mask-like face. She was very nice, but she just had a really flat affect, and she shuffled. She didn't move really slow, but she really shuffled. Stage 3 is moderate disease, and that's when you're seeing posture instability, unsteady gait, and of course you're going to see more of the shaking. And stage 4 is severe disability, akinesia and rigidity. So you're not able to move those limbs as freely as the patient should be able to. And then stage 5 is complete dependence, which is going to also lead to death. Medications for this disorder, the big hitters is um, uh, Levodopa. And levodopa is a medication that is usually piggybacked with another medication, and that allows you to naturally make dopamine within your brain. And it's taken orally, and it passes into the brain and is converted to dopamine. And levodopa is usually combined with carbidopa, and carbidopa creates or allows levodopa to get to the brain and then convert to dopamine for effectiveness of the two medications. And that's going to be the big hitters of Alzheimer's. You have your MAOB inhibitors. You're going to have your anticholinergic medication, and treatments is to allow for optimal lifestyle, optimal movement. We're trying to keep this person moving as much as they can. Common nursing diagnoses impair physical mobility, fall risk because of their shuffle gait. You want to move everything out of their way. Risk for self-care deficit. And there's also depression that can impact these patients. So we want to be really sensitive, have plans set for them for their end of life, because inevitably they're going to die from this disorder.